Hello everyone, I'm Dave Bondy. How are you doing? Go ahead and click the subscribe button on this YouTube page, my YouTube page down below, right down there. I want you to do that because when I'm on Facebook putting stuff out, not everyone sees my posts. And I know a lot of you want to see the videos that I have. So click subscribe. So I'm talking about COVID-19 and non-COVID-19 related things. Earlier today, I was interviewing a doctor, Dr. Brenda Coughlin with the Great Lakes Bay Health Centers. She's a great woman with a great organization. They do so much to help people in mid-Michigan, those who don't have insurance or those who can't afford a lot. They do COVID testing, so much they do to help people. But when I was interviewing Dr. Coughlin today, she brought up a good point that people are getting sick, people are dying from things other than COVID-19. People are dying from heart disease, there's suicides, the mental health. There's so much going on despite COVID-19. And she admits COVID-19 is very serious indeed. But she wants everyone to make sure they're taking care of their health in general. She tells me she's worried that children may not be getting their vaccinations, and she is actually seeing it, that children are not getting vaccinations for measles, mumps, rubella. She is worried that we could have a upheaval or a increase in measles cases because people are not getting vaccinations because they're scared to leave the house or scared to go to the doctor's office. I talked to Dr. Coughlin earlier, and I want to play a little bit of an interview for you. What this is, she is talking about how people are not taking care of their health and how they are scared to go to the office, the doctor's office. So I want to play this real quick. It is about a 2-minute soundbite, as they say in television. Let me put this up on the screen.
Actually, the rate of heart deaths has increased since coronavirus has been here, and it appears that people are not taking care of their chronic diseases as well. So people with diabetes, hypertension, asthma are afraid to come in, so they don't come in when they're ill, and the rate of deaths outside of the hospital has gone up fairly significantly because people aren't getting treated. It's really critical that people come in and get treated.
So and that could possibly easily be prevented.
Correct. That's what we're working to do. So we call our patients, we're calling our patients. Like, you haven't been here, you've got diabetes, we need to check up on you. Wow. Can you come in? If you can't come in, we'll get the tests done outside of a visit. So we have the information when you come in for a visit. Or we've been prescribing blood pressure cuffs to our patients with high blood pressure so they can check their blood pressure at home, and we can do a televisit to control their blood pressure medicine.
Gotcha. Okay. What's the number one message, I guess? Is it still okay to, you have so many clients, but you can take more? I mean, how does it work if there's no limit as to the need? Because the need's growing in the community, but you're always available?
Yes, the need is growing, and we have everything. We do everything we can to provide for the patients who have the need. We're very concerned about the behavioral health need following behind the coronavirus. There's a lot of despair, a lot of people who are struggling with hope because this coronavirus seems relentless. It just keeps going. And so we're doing a lot of work trying to figure out how to support people, help with possible depression, other diseases. That anxiety has been huge. So working with our patients to be sure you take care of yourself. We need self-care. We need to eat well. We need to exercise. We need to make sure that you socialize, perhaps not physically, but call people, check on them, do the touch, because we are social beings, and that social relationship is really important to our health.
Well, there you go. That was Dr. Coughlin speaking right there. Brenda Coughlin, a great woman. I appreciate her for doing the interview with me. Basically saying that we need to take care of ourselves, go to the doctor, get our vaccinations. She said people are dying who should not be dying because of COVID-19, because they're scared to go to the doctor. There's so many other, reasons why. And she says, no, you shouldn't be doing that. She said the Great Lakes Bay Health Centers, they are so safe and secure. They go above and beyond to make sure everyone is taken care of. She said they even have a phone in the parking lot you can call if you want to do a telehealth visit that way, or to let you know to come into the building. I want to run down real quick the numbers from the state of Michigan today. The state of Michigan is reporting 67,237 cases. 6,015 deaths, and this is the part that has a lot of people talking right here. 610 daily confirmed cases today. 10 new deaths being reported by the state of Michigan today. There's also an interesting number that I am keeping an eye on that you do not hear a lot about, but I want to show it to you right here. This is the number of people who are hospitalized in the state of Michigan from COVID-19. Now, this is according to the MDHHS. So right now, according to the MDHHS, there are 349 people hospitalized in the state of Michigan from COVID-19. In the entire state, 349 people are hospitalized. The hospitals keep their own records, and I'm going to scroll down and show you their records. These are the hospitals currently. This is as of, well, actually, this is as of the 6th. So this was 2 days ago. I apologize. This was as of 2 days ago. So in Michigan, these are all the health systems here on the left, all the health systems. Covenant, 13 people hospitalized. Beaumont, 115. Hurley, 2 people. So Hurley Medical Center has 2 people hospitalized. Trying to look at some of these. Mid-Michigan Health, 3. Munson Health System, 5. Pontiac, 1. Prime Health, 9. ProMedica, 6. Sparrow Health System, 17. Spectrum, 34. Trinity, 57. So 505 people in the state of Michigan are hospitalized from the coronavirus. This is in the entire state. 174 of those people, I believe, what is this? They are in ICU. So right now, we have 174 people in the state of Michigan in ICU, and 65% of the capacity at hospitals in Michigan, they are 65% full right now. So that, some interesting statistics that you don't necessarily hear all the time, but I like to put out there. The state updates those statistics every so often. I also want to play, before I let you go, because there is some concern that Governor Gretchen Whitmer may dial back when it comes to the economy and so forth. And I want to see if I can bring this up on the screen if I have it. Earlier this week, Governor Whitmer was talking to CNN, and I have that interview, and I want to play it for you because Governor Whitmer was asked if she would dial things back and move our economy backwards because of the numbers. I'm going to play for you right now what she told CNN.
Well, of course, I was disappointed. You know, COVID-19 is still very present here in Michigan and across the country, obviously. We have taken Herculean efforts to push our curve down. We've saved thousands of lives. Michigan has been on the forefront. We've done an incredible amount of work, and I would hate to think that the sacrifice that we've made could be made in vain because some people are losing interest or are dropping their guard. We've got to double down right now more than ever.
Well, there you go. That was Governor Gretchen Whitmer earlier in the week. She has given no indication on if she will actually do that. She has a news conference set for, sorry, everyone, sorry.
Across the country.
Sorry. She has a news conference set for Thursday morning. I'm recording this right now, and this is Wednesday evening. So a lot of interesting information. And once again, if you're still watching right now, I appreciate it. Go ahead and subscribe to my YouTube channel because Facebook, you know Facebook, they hide stuff at times. Maybe not intentionally. I'm not saying that. The algorithm takes control. I have 45,000 people on my Facebook page. Facebook can't push it out to everybody, I guess. So like my YouTube page by hitting the button below. Hit the subscribe button down below to make sure you don't miss any of my videos. I'm a journalist. I'm all about giving both sides, giving you all of the stats, all of the information. The experts are saying continue to wear a mask to stay safe. I'm not going to get into the argument, are masks safe or not. Most doctors, almost all doctors are saying masks can help stop the spread of the virus. Once again, that's what doctors are saying. Other people are saying other things. So I am just presenting information. That's my job. So don't hate me. I know a lot of people don't like sometimes what I report, but I'm just giving you the facts. Thank you very much, everyone. Go ahead and comment below and subscribe to my channel. I'd be happy to see you soon. Have a good day.